Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, back with you this morning, broadcasting live from the Dolph Simons Family Studio. We are delighted to be here with you. I'm joined, of course, by Dr. Hawkeye. Actually, that's really not his real name. His real name is Dr. Dana, and there's a reason that he's called Dr. Dana now, and you're going to see that at the end of the show. We're going to show you why he is now known as Dr. Dana, although I'm still going to call him Hawk. There's a really important graphic going on here in the state of Kansas, a really important issue that's going on in the state of Kansas, and we are so fortunate today to have Dr. Lee Norman, who's the Secretary of KDHE, join us so we can have a conversation about what the heck's going on, because we see the numbers, as this graph shows, throughout the state and all sorts of cities of the state, all sorts of different counties in the state, rising rapidly. I was looking at a map that's put out by Harvard it's county by county throughout the United States, and several counties in Kansas are brick red, which means that's like Florida, folks. That means we're on fire and we have a problem. We have to work on that because we don't want to be that way, and we don't want to see that kind of a rapid rise in coronavirus. And the way to do it is what we know. We've done it before. We've bent the curve. We can do it again. And it's really all about wearing a mask, washing your hands, keeping your distance, not touching your face. Don't go out when you're sick, cough into your elbow. But the big things we just said, it's all about that distancing. And how do you accomplish distancing? You stay further away. You wear your mask. Otherwise, numbers begin to rise, and it looks like this. So we're going to have a conversation with Lee Norman about that. But before we go there, Dana, how is it? We're rising, aren't we?
It's not good.
I know. Go for it.
I think we had
Dr. Dana.
22 2 days ago, Monday. We had 25 yesterday. We have 30 in the hospital today. Again, we have a couple pediatric patients. Of those, 12 are in the ICU, but only 2 are on the vent. So if there's a silver lining, so far, we only have 2 and not 10 of them on the vent.
It's been a long time since we've been at 30, Dana.
Yes, it's really concerning, knowing what is going on in the community here and other places in the United States.
Yeah. Just to be clear, these are really the wrong trends, because coronavirus is not influenza.
No.
Don't let anyone tell you that it's influenza. Influenza doesn't affect this many people. It doesn't put this many people into the hospital. Yeah. We've got to get over the idea that this is just influenza, because that is just false. And, I know there are different political beliefs, blah, 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 but, we're doctors. We're not going to tell you politics. We're just going to tell you, here's the medical truth. This is not influenza. And anybody who tells you it is just doesn't know what they're talking about. Because as physicians, we'll tell you, we take care of folks with COVID. We take care of people with influenza. It is not the same.
No.
COVID is very real. And anyone who's trying to tell you that it's not real is they're just not looking at the facts. And so it's really important that we have honest, real facts to talk about. And one of the most honest, blunt people I know is Lee Norman. One of the things that I appreciate about him the most. Dr. Norman has served in the military. He served here at KU. He's been part of Desert Storm and other things over in Iraq and in Afghanistan. He's seen the world, and now he's helping guide Kansas through this crisis, and we're very fortunate to have his leadership. Dr. Norman, talk to us a little bit. How are things going from your standpoint?
Well, good morning, you guys. It's awful. We were winning the fight, and on May 26th, everything started to change. And so the numbers are going up dramatically. We're over 20,000 cases. We're approaching 300 deaths. And I don't have today's numbers yet statewide, but I'll have those about 9:30. 101 counties, which means there's 4 counties where we just haven't diagnosed a case yet, because we know it's got to be in every county. And on Monday, we had almost 1,500 new cases from the prior Friday. So it is just skyrocketing. And of course, you talked about it, Dana, on the numbers. Wichita is even seeing a steeper rise. There's at least one hospital whose intensive care unit is completely full with COVID-19 patients. And we have fumbled the ball, people, and that's the bottom line. Mass gatherings are occurring, soccer tournaments are occurring, so it's sporting. We had one bar, or actually 3 bars in one town that have associated with 94 cases, and I'm sure that'll triple. So everything is within our grasp, and we are fumbling it because of inattentiveness and politics, and it's just got to stop. Otherwise, we're going to see this continued rise.
Well, and the problem is that as it rises, then we have to start worrying about things shutting down again. And I'll just be honest, I like being able to go to the store if I need to, or go to the hardware store, or go down to the plaza and get some clothes altered, and get my shoes fixed. And, you know, that's a problem, because as we fumbled the ball, as you so aptly said, what we've done is undo all the good work people did by staying sheltered in place. And I don't think that we have to shelter in place. Lee, let's talk a little bit about that. But, you know, Robert Redfield, the head of CDC, came out and said, I think it was yesterday, you know, guys, you don't have to shelter in place. You just have to wear masks and socially distance. And if you can do that, we'll stop this. We'll stem it. It's not a hard answer, and yet we're making it hard. Lee, thoughts about that?
Yeah, and to that point, we are at a much different place in Kansas, despite my admonishment of how badly we're doing at the personal level. We are in a lot different place compared to where we peaked out in late April. Although I think the numbers will show today that we've already surpassed that peak that we had in April. One silver lining of the cloud: the Harvard Global Health Institute publishes how state by state we're doing with testing on a per capita basis, and we are in the top dozen in terms of testing per capita, and that's compared to where we were in April, where we didn't have enough testing capabilities. At least now we can do that. And the way they assess that, Steve, is they say if for every symptomatic case, you can test that person and 10 people around them. However, I will put out a cautionary note, is that we're getting flooded, both at the state lab and the commercial labs. I'm sure you've seen that. So the turnaround time on the test results is taking longer and longer. Our lab is still 1 day. As part of our disease investigation, we had over 1,700 samples come in just yesterday. So you can see that the numbers are skyrocketing, but the commercial labs are taking longer. And you guys know very well, if you have a suspicion somebody's COVID-19, you test them. You don't want to wait 3 days or 4 days. I know some hospital labs like you guys have your own internal capacity to do pretty well on that and do well on that, but there's a lot statewide that don't have that same capability. And what do we need to keep from closing down? We have to do PCR testing for every person that needs a test. We're pretty much there. Hospitals have to be able to do some surge capabilities. We're doing pretty well there for now. Healthcare workers need to have adequate PPE. Our stockpiles are good, and we're pretty good for now. And syndromic surveillance is in place by our state agency, which we do have in place. So I keep emphasizing for now so that it reemphasizes what you guys are saying about the things that are within our control, each and every person to make so they can keep from getting sick. Especially mass gatherings are evil. And I don't care what kind of mass gatherings they are, they're just inherently evil. We're seeing sadness on top of sadness. We've seen quite a number of illnesses and quite a few deaths from funerals, from attending funerals. People shake hands at funerals. They give hugs and kisses at funerals. Bad idea. That adds sadness on top of sadness.
And isn't that's so striking? I know I have a very good friend who's being asked to help organize a wedding shower, and it's like, she's like, I don't know how I do that in good conscience. And it's in one of the counties that doesn't have a mask wearing requirement. And so, boy, how do people get put into terrible positions? And you think about that and think, how do we negotiate our way out of that? Because the truth is that if people would just be thoughtful and take care of each other, it's that first order, do unto others you would have them do unto you. You don't want anybody doing coronavirus unto you. So we just have to take care of each other, and that doesn't appear to be the direction we have. It's like we want normalcy so bad, we've forgotten that there's still a pandemic.
Yep.
Lee, please go ahead.
Oh, I was just going to say, the other thing, and you mentioned, Steve, about not wanting to get political, and yet some of the problems here is political incursion and legislative incursion, quite honestly. Removing for example, the phased-in plan that the governor put out, occurred on May 26th. That's when most of the counties kind of took away any kind of mandate and had it be guidance. And that's when we lost control of the state. So, and then the mask mandate was turned to the counties as well, again, because of legislative actions and regulatory actions. And people should not have to have regulations and mandates to do the right thing. People need to use their own brain and do what's safe. And but the legislature hasn't helped us in this one either, taking those things away.
You know, it's funny. It's like sometimes science is, you're made to feel a little evil, and science is not evil. Science just looks at the data, makes observations, and reports that data. And they try to interpret the information so people know what's going on and report the results. But you have to just be honest and transparent about that. And I think when we get into trouble is when we try to use the data, scientific data, to make a political point. What we're trying to do is use the scientific data in this situation to make a point about healthcare and about medical knowledge. And you know, we just got to be able to say there's a lot of stuff we don't know, but we do know this: coronavirus spreads when you breathe out and you have a little cloud around you, and other people get into your cloud. That's how it spreads. So how do you stop that spread? You put a mask on so you don't create this big cloud, and your mask is trapped, or that cloud you would create of all the stuff you breathe out is trapped in the mask. It's that simple. And that's why you try and get further away from somebody. That's why you ask them to wear a mask. And it feels like we've lost the science and the politics. You know, yesterday, Lee, there was a pretty big announcement that came out about hospitals are no longer to report data to the CDC, but rather to Health and Human Services. That feels concerning to me because the CDC is an independent agency, and Health and Human Services is not necessarily. Talk a little bit about that.
Yeah, it's very concerning. And I'll tell you, this happened so abruptly. I mean, we've been using NHSN as a program at CDC we've been relying on, and it is the data that comes from that tell us about hospital capacity, hospital beds, ICU beds, ventilators, et cetera. We use it for day-to-day management of surge and surge capacity. The fact is, we're going to investigate. I talked to the governor last night about this. She shares our concern that why is the data being sequestered away to something under White House control? It makes it harder for us to know that the data is being used in an objective manner. So big concern on our part, separate from the fact that it puts a huge burden on hospitals to then change its processes, change its people. So we're here in the middle of a house fire. You know, we're firemen putting out a house fire, and somebody's coming and saying, here, let me turn down your hose so you have less water to work with and divert your people. It just doesn't make any sense.
It's a tough thing for us.
In a house fire with a squirt gun.
House fire with a squirt gun. Dr. Hawkeye, Dr. Danis just put up.
There you go.
So, you know, I think it is, you know, those of us who fight this battle every day are a little frustrated. What you can count on from us in this program is we're going to continue to be honest. We'll tell you what our numbers are. And I'll report to you what, you know, the chief medical officers, we know the numbers are rising throughout the city. When we had our call yesterday, the same group of hospitals that are reporting the data consistently, we hit our highest peak that we've had since at the beginning of this crisis for the number of hospitalized patients here. And so, and the problem with the peak is it didn't blunt, it's continuing to rise. Right. And what I would just urge and just remind everybody is to be KC. Whether or not governors and governments and presidents and everybody else fights about stuff, what we need to do as good, conscious Midwestern folk is to sit back and just put our masks on. This is not hard. And unfortunately, people are making it harder than it needs to be. And it's really not hard. Again, when you breathe out, you create a little crowd actually. I'm not sure I meant that, but I'm going to say it now. A crowded cloud of little particles that contain all the stuff that's in your mouth and in your sinuses and in your throat. And that's where the novel coronavirus likes to hide out. So when you breathe out, it's in there. It's in that little cloud. And if you just remember what it's like when you go outside and it's cold outside and you breathe out and you watch that kind of, your breath go out, you can see it because it's a little different color out there. It's that dark gray stuff, that mist that you breathe out. Well, that's your cloud, right? And that cloud usually goes 3 feet. If you do it hard, it can go 6 or 8 feet. Yeah. And so your goal is to put a mask on and stop the cloud. That's really what it is. Stop the cloud. And I think we can do that, and then we can keep each other safe, and then we can keep businesses open, and then we don't mess up the economy. You know, the worst part about it is when you deny the medical facts, the things you put in jeopardy are your life, your income and your economy and your loved ones. Now, I'm not saying that's a bad choice, but folks, that's a terrible choice. Because all you have to do is wear a mask. It's not that hard.
No.
So you and I don't have a mask on right now because we're like 8 feet or 10 feet apart in here. And so, okay, fine, it's safe. We also know how fast the room is exchanging air and all sorts of stuff. And hospitals are built for that. I walk out of this room, I promise you have a mask. When I went to the grocery store, I had a mask on. When I go out shopping, I go to the mask. When I put the K&K fly fishers, you know what? Got my mask on. When I go to Renter's shoe repair because my shoes are falling apart, got my mask on. When I go to the hardware store to pick up some light bulbs because of the freaking ceilings that are high, you have to go get on a ladder and get your light bulb in there. Well, you know what? Have my mask on. That's what you have to do. You got to wear a mask.
And
it's
we're trying to be proactive in helping you protect yourself and others. And we see this every year in people who get influenza or their children who get influenza. And what do they come back and say? I wish I would have gotten influenza vaccination.
Yeah.
We've seen stories about people who have gone to the bars in groups and gotten COVID. And what did they say? I wish we wouldn't have gone to the bars. We don't want it to come down to you getting it or your loved ones getting it, and then you change your practices. But unfortunately, sometimes that is what is going to happen if we don't have a collective culture change and start doing these things that we continue to talk about to help protect you and others.
And I would just say, we had a powerful discussion yesterday from Anil who talked a lot about what it was like to have tried to survive COVID. Yeah. And this is a pretty young guy who's got, a family and children and a business and a small business that he's the head of and runs. And he's got a few health problems, but he's not. I mean, he was a pretty healthy guy beforehand, right? I mean, he drove trucks. I mean, he's a good guy. And he had to survive COVID. That's hard. Are there questions from the media so far today? If not,
I've got a question. This is Brian Grimmett with the Kansas News Service. I'm just wondering if, I know that there's a lot that we don't know still at this point, but I was wondering from your experiences so far, what we can say about what we do know about how the coronavirus impacts some patients.
Lee, do you want to start with that, and then we'll pick that up.
Sure. I punt those to the guys in the room there that are the front line of clinicians, but I will say it's a smart question. It does affect people differently. Clearly, there's risk categories of older, obese, and people with multiple conditions. Younger people are more likely to have less of a problem with it, although they can get trouble with it. The curious thing is that it's not just a respiratory illness, and Dr. Stites brought this up at the top of the meeting, and that is it's not influenza and it's not just respiratory. We see strokes and heart things. We see certainly kidneys problems and vascular problems with it. So it's a different animal. I'll turn it over to those other guys for the specifics.
Absolutely. I was talking with my division head, Dr. Dan Hinthorn, today actually about that. We know that you can have asymptomatic. We know that a lot of people are asymptomatic. That is great. But we know that there's a small population that has to go to the hospital because they have respiratory symptoms or other types of symptoms. I saw a woman who was in the hospital. She was in her mid-70s. She just had confusion, encephalopathy, so she just had central nervous system effects. We know that it can have the blood clotting. But the problem is that even though you are older and probably more at risk, even if you're younger, as we've seen in our hospital, as we have young people, you are still at risk. It is a roll of the dice, unfortunately. And we don't know exactly why. I believe there is a genetic component. Is it the blood type? It's probably not that, but it's probably multiple factors in our genetics that allow some people to be perfectly fine and other people to develop the respiratory distress, the blood clotting, all that inflammation in their body, and we just don't know. And so anytime you are going out and not taking those precautions and putting yourself at risk of infection, you are essentially rolling the dice for those types of things to happen.
Yeah, I think what we have to realize is that this is not made up, and the medical facts are the medical facts. And here's what we have. We've had 300 and about now 80 admissions or so with COVID-19. We've had 27 deaths, which puts our death rate right around 8%. That's lower than what New York had, significantly lower actually. So we know we've gotten better at treatment, and as long as we don't get overwhelmed, you're going to be able to do a better job at taking care of folks. But it's still deadly, right? And the difference with influenza as a virus can make you feel terrible. But the things that you die from are usually secondary infections, especially from staph, a type of a bacteria. with SARS-CoV-2, it causes this disease, COVID-19, and COVID-19 can affect any organ of the body, but it doesn't take something else to help. It doesn't take a bacterial infection on top of it. It just kills you by itself. And it can kill you in many different ways. It can kill you because it can cause your heart to beat irregularly. You know, if you're an athlete who's had it, we have to do an EKG after you recover before you can go back to active sports, because if we don't, you can have a heart irregularity even if you feel great. It can kill you by causing blood clots in your lung. It can kill you by filling your lung up with fluid. It can kill you by destroying your liver or by destroying your nervous system. It can kill you in so many ways. It can kill you by making you feel so depressed or demented that you take your own life. This is a really, really bad virus. It's also preventable. And I think that's what that's got to be the story. We have to prevent this as best we can. The way we prevent it is with good infection control. Other questions? Other questions for media this morning?
Yes, this is John Hanna with the Associated Press. A question for Dr. Norman. Why wouldn't it be advisable to shut down bars and put back restrictions on restaurants statewide? That seems, and ratchet down on public gatherings again, maybe to 15 people. Those seem to be the three places, given the statistics, where you all are consistently complaining. You know, this is the state that made Carrie Nation famous, so why don't we just, you know, why isn't there a statewide order on that?
Never been likened to Carrie Nation before, John, but, you know, there's always a first. You're right. The pattern that's emerging is different than what we saw earlier, not purely in congregate settings like nursing homes and meatpacking plants and prisons. It is free-living humans. And I think the biggest problem that, from a policy perspective, quite honestly, is that 105 counties that, and you know how deeply ingrained in Kansas it is, one size does not fit all. And I think that's very much what we are pushing against, and still hoping that we can be more restrictive in certain counties and less restrictive in counties that are having very little problems and or are more compliant with the recommendations or requirements by the counties. That will have to be I think we'll continuously reevaluate that, John, from a policy perspective.
Other questions?
This is Ray Daniel with 41 Action News. Hello and good morning. I was just wondering, you kind of already touched on it a little bit, but just what are some of the acute complications when it comes to this virus? And for patients who were in ICU for a long time, you know, this isn't an overnight wake up, I feel great again. Talk a little bit about the long-term impacts this virus can have for people who are really, really suffering from this virus.
So, you know, one of the things that we know about people who have been in the ICU, Ray, is that if you're there and you're really sick, the recovery period is not overnight. It can take months to do that. The average recovery from really severe illness in the ICU is anywhere from 3 to 12 months. Partly it's due to malnourishment, partly it's due to deconditioning, partly it's due to some of the mental stress and post-traumatic things that go on. And so it's not a simple, hey, I got recovered, I'm better, I'm off the ventilator, I'm ready to go home. Usually the recovery is very long, and there's a lot of muscle wasting that takes place, so it's a hard recovery. When we get somebody really critically ill in the ICU and they get better, we tell them, look, you're not going to feel the same for a year. And if you feel better within that year, that's great, but don't expect to be back to normal for a year. And there's a lot of rehab and a lot of effort that goes along with that. Your endurance will be down. You're going to be chronically tired. You go home, you're going to be active for a while, and after an hour or two, and then you're ready to go back to bed and sleep. I mean, it's just really hard to recover from that degree of illness. And it's because every part of your body has been injured. And it takes a while to repair. We want it to repair overnight, give us that special medicine that does that. But the reality is there is no repair medicine like that. It's just time, good nutrition, and effort. So really, if you get to the point of being on a ventilator and being that sick with COVID-19, the recovery can be very long. And Anil really talked about that yesterday. He's still recovering and still trying to deal with some of the complications that came about from it. So, we can save a life, but we don't get you back to your normal life. That's something that you as an individual do. There's also things that can happen that are harder to recover from because patients can have different kinds of permanent injury, and stroke being one of the worst. We've seen that happen in our hospital and other places where people get COVID-19 and they actually have strokes from it. And if they have a stroke, it's hard to recover from. And so I think that's another complication.
Yep,
Anything
absolutely.
else?
Yeah, if you're sick enough to go into the ICU and on the ventilator, chances are you have a pneumonia, an inflammatory process in your lungs that's not letting you get gas exchange good. You have the blood clots. It takes time for your body to resorb all those things and get that back to normal. So just from a physiologic standpoint, you're going to have those effects as well.
And then, Lee, I know you're going to have to run in a minute, but that just puts a greater burden on all society because those folks can't get back to work. They can't get to doing the things they want to get done. And then that hurts their families. It hurts their loved ones. It hurts their income because they're not able to work. And thoughts about the long-term toll here of COVID-19 on our state?
Yeah, it's exactly as you say, Steve. The people look at numbers of hospitalizations, cases, and deaths, but that's just a tip of the iceberg of the personal and economic and societal damage that occurs. I mean, there's hundreds of billions of dollars nationwide and billions of dollars within our own state for medical care, taxes, the public assistance programs, and Medicaid. There's lots of disability. You guys both talked about neurologic things, and it sets people up for long rehab processes. It threatens jobs. A lot of people don't have a lot of economic stability or resiliency in their employment situation, so it has some people result in unemployment. It leads, and you pointed this out, Steve, to depression and family discord and family breakups. So we have to do a lot with attention to the mental health systems that we have in the state, which are quite honestly are not sufficient. So it's pervasive in every aspect. And I think another one is how erosive really it is for people to have a low-level chronic anxiety. When you get sleep disturbances and weight loss, weight gain, staying home and drinking too much. I mean, it's just it takes the resiliency required and how we have to watch our friends and families and loved ones. It's just so critical to stay close to those we care about that need our help. It's a big cost.
It is a big cost. It's tough. It's really tough. So, Leah, the longer you can stay with us, that's great. I know you may have to pop off. I just want to say, A, thanks for being on our program today. B, thanks for all you do. And C, just a reminder to everybody, Lee, thank you for your service to the country. You've done a lot in your life over the years, and you've been in war, and you've been in peace, and you've been in a lot of places. So I just want to say thank you for that.
Well, I'll tell you what, this, to me, Steve and Dana, feels like Army deployment. When you think about the battle rhythm or the pace, the operational tempo, matter of fact, we organized our whole effort here very much like a battle theater, and I'm really glad we did. It's kept people focused. My staff here at KDHE has just been unbelievable in our lab, and they are stretched. We have not had a person get sick. We have not had a person quit. And all the while, keep in mind, we're still running a $3 billion Medicaid program and the Division of the Environment. So everything EPA, and those things don't go to sleep just because we're having COVID. So I feel really blessed to have the staff I have, and I appreciate being on the show with you. This has been I think it's really a great way to communicate. I do need to sign off. I have incident command right now, as a matter of fact. So
good luck.
Stay safe,
stay healthy. You bet. You stay healthy. I bet you guys are all wearing masks.
The number 3 in Kansas, number 1.
Got that.
Jill, first of all, media, other questions that you may have.
Yes, Dr. Stites, John Hanna with the Associated Press again. There's a lot of discussion about reopening schools next month. As a medical person, would you be talking about that right now, given the numbers we're seeing?
John, you asked me that just as Lee Norman got off. Darn it, I'm not going to put that to him. No, you know what? Here's the answer. We're going to spend an entire week next week talking about school reopenings. And so I would invite you to listen. Here's what I would say to you. We still have some time to make the decision. The question is not should we reopen schools. I'm going to flip that question on itself. because there's plenty of evidence that says we should reopen schools for the mental health and development of kids.
Yes.
The question is, can we reopen schools safely? That's the question we have to focus on. And I think there is evidence that says there are ways to do that safely. And I think we need to focus our discussion on whether or not we're following the basic principles of infection control. What we know is that people in junior high and high school are much more likely to spread this disease than younger kids are. And so as much as I want a 2 or 3-year-old to wear a mask, probably not going to happen in preschool, but actually they don't tend to spread the disease quite as much. On the other hand, as long as you can, whatever, and I'd have to ask a developmental pediatrician what the right age is, but to start wearing masks, and then everybody needs to wear a mask throughout the school day. And then you need to figure out how you socially distance folks at school as best you can. And you know what? I know high school kids are going to congregate in the lobby, right? We're not going to stop that. But high school kids can wear a mask, and that helps stop the cloud, and that helps stop the spread. I think it's all about our devotion, and I choose that word very carefully, our devotion to keeping each other safe and making schools safe, and recognizing the issue is what happens when young folks who, teenagers, and they come back to home and maybe they're not as sick, but then their folks get sick, and then you start a really bad chain of events. And we have some of that in our own hospital. We have some physicians here who are out because their kids brought home COVID into the house. So, I think that's really got to be the question. And so next week, we're going to spend a whole bunch of time on it. So when you ask me, should schools reopen? I would say, sure, let's reopen if you can do it safely. And if you can do it under the principles, Dane, of infection control, so the schools don't become a flashpoint. Because if we've done that, you're not going to keep the schools open. You see, that's really the conundrum we're in. If we just ignore it and we let schools come back open without doing that, then all we've done is guarantee that the schools will close, because we won't have a choice, because all the teachers will be sick, the kids will be sick, their parents are going to be sick, and then we're going to have a real problem, Dana. So we just have to be thoughtful.
Yeah, absolutely. And, again, the CDC has good guidance. It is strict, but that is the gold standard. All of the schools, the school districts should look at all of those things. And it goes back to just the pillars that we've been talking about. How well can you physically distance? Masks are vitally important. Adequate hand sanitizer in the rooms is vitally important. Doing all those things that we've talked about, just putting it into the context of schools to keep the children safe, to keep the teachers, the administration, other support staff safe too, which is vitally important as well.
And tomorrow it'll be an interesting discussion, because we're going to have Chancellor Doug Girard, who is himself a physician, on our program with us. And I'm sure we'll be talking a little bit about reopening KU safely. And I know we've worked really hard to help get KU safely reopened. Other media questions? All right, so please.
Do we know roughly how many ICU beds we have in the region and how many ICU patients we have currently?
Did you ask me that yesterday? Yeah. And I promised an answer to ICU beds. I've got that number upstairs, and I didn't follow up. And I know the number of ventilators. So tomorrow I will be prepared with both the number of ventilators that we had on our CMO calls on the hospitals that reported the data, and I can tell, and I will tell you the ventilator capacity right now is not the big issue. Our big issue is going to be total bed capacity, because we're seeing younger people come in and what that does to the rest of the patients. So here's our dilemma as a hospital. We've got capacity. And I think all hospitals have capacity to take care of routine patients. The problem that will happen is that once you start getting really full of COVID, you can't take care of all the other sick folks in the country. And there's a good article yesterday in the Washington Post, and it spoke to this question about how people are still they're still avoiding hospitals, or avoiding them again because they're afraid to come back as a result of illness. So we don't want to see that. We want to maintain our ability to take care of folks. Our biggest question will be bed capacity. And if we get too many people, then it will become ICU and ventilator capacity, as we've seen in Houston and Miami and in other cities. I will have a more direct answer for you tomorrow. I apologize I didn't get that data for you today.
I think one other thing to add to that is going to be drug capacity too. We need to make sure that we do have the important drugs. We are kind of having a little bit lower amounts of the remdesivir now. And so as we move forward, as
Yeah, we
Dr.
don't get a lot
Stites
more
said,
shipments.
right.
We were looking at our numbers yesterday about remdesivir shipments. There's not, the next few shipments are small.
Right.
Because it's being spread throughout the country and there's a big rise
Yeah.
in cases. So we're not going to get as much. So that's going to be a problem.
So yes, it's not so much the ventilators you talked about, it, but it's capacity overall, and then these other vital drugs as well.
Okay, 2 quick thoughts. We're going to have to sign off this morning. We haven't answered questions from our public. So just remember, the listening public, Friday is that day where we'll have an opportunity to do that. I want to think, though, it's great to have the media on and ask these questions and help us get this message out about, what do you have to do in order to stay safe? And, I've been a bit of a tirade this morning, and I that's probably because I got sleep last night, so watch out for that. It's not that hard. It really is about wearing a mask. It's funny. You go out and you go to a restaurant, and it's like, no shoes, no shirt, no service.
Right.
You got to. There's service that we already do. There's things we have to do. Why is wearing a mask really so hard if it's temporary? Now it's a long temporary. It's another 6 months. Okay, fine. We're going to get vaccination. I think vaccination is going to be effective. This is not the way forward forever, but it is the way forward to stay safe, and it is the way forward to keep the economy open. It is the way forward to keep schools open. It is the way forward to be able to take care of each other. Is it really so bad to wear a mask and accomplish those things? Or is the right to not wear a mask and make other people sick so important that we can just exercise that? I think that's really what we're talking about. That cloud you breathe out is the problem. And we all do it. And the only way to stop it is to stop the cloud from leaving your body. The way you do it is wear a darn mask. And it's really not that hard. And so we can bend the curve. We can keep our economy open.
Yep.
We can get schools opened up. But you've got to do it with responsibility. Freedom with responsibility. And in this case, the responsibility, Dana, is to wear a mask.
And I would like to, add to that, as we have talked about, this is a local thing that we have evidence that it works. The hairstylists.
Oh, that's a great story.
That is now published in the CDC journal MMWR. So it's actually a published article now showing that masks work. When you have 130 or 140 people interacting with 2 hairstylists that had it, but both parties were wearing the masks, there wasn't spread. And so.
And you know what? I want to go get my hair cut. So gosh darn it, folks, keep your mask on.
Yes.
Because I have so much hair to cut.
Yeah.
That's just really important. Hey, listen, we want to show you some masks on camera. So thank you for continuing to send us your photos showing us how you're wearing a mask. It's really not a bad ask. Lexi is doing a great job, and she wears her mask when she's going out in public. We love this picture from Amanda. Amanda writes, "This is my mom and my children practicing safe social distancing and mask wearing at the Stillwell Farmers Market. Well done, Amanda and family. They washed their hands before and after, and Grandma picked up all the veggies for the kids and put them in their baskets. That's perfect. Well done." I also want to say thanks to Angela for wearing a mask even while driving, and good job. Then Malia is age 5, who loves unicorns and toucans, and you can see that big smile coming through her adorable face, even though she has that mask on. And look at this last one. This is special. A big shout out to Dr. Dana, because that's Dana Hawkinson. These are his nephews. The older brother has to wear a mask to daycare. He's doing some great mentoring with that younger sibling. So this is where Dr. Dana comes from. Geez, Dana, how can you not just go and play with those guys constantly?
We love to get up there. They're in Madison. My sister's dealing with some of the COVID stuff at the University of Wisconsin-Madison hospitals. So, But she has had good training for her kids, and her oldest, AJ, understands that when I have to go to daycare, I have to wear a mask.
That's great. So tomorrow, Doug Girard is the chancellor at KU. He'll be on with us. We look forward to that program. He's a good friend of mine and a physician. We'll enjoy talking with him and talking about what the future holds for KU and really as a reflection of what it's going to do around public universities and colleges across the country. Most importantly, we want to thank you. We love being with y'all. This is the best. We feel like we're just trying to help. This is kind of like what we do in clinic. We talk to people about what the medical truths are.
Yep.
We counsel our patients. And we sort of feel like we have that relationship with you. And what we're trying to do is just tell you the truth about staying safe so you can continue to be here with us. Don't let that curve, don't let it get you. Remember, you did it before. You bent the curve. You showed the nation how Kansas City can do it. And I just say to you again, BKC, we can get this done. Stay safe, wear your mask, And remember, there's still no place like home. We'll see you tomorrow.